All right, so we're going to go ahead and jump right in today. Oh, there we go. For our intros, you can see a picture. I'm in yellow, Kelly's in pink. And I may have photoshopped a new staff member into the picture. It's one of those like, where's Waldo? Because the photoshopping's fantastic, so I'm sure you can't pick it up. That's Graciela Laguna. She's new with our organization, doing some underserved populations work. And also we have Lynn Johnson, who's on the call with us as well, who's to the right of Kelly in the pink, and she's doing some program development work. All right, really quick 101 stuff. You've got your panel on the right. I'm going to go ahead and grab a pen because this is cool. All right, so right here is where you can mute yourself. You can go ahead and type right here where it says comments. You have a little hand raising. It might be higher or lower. If you have any questions and you want to be unmuted, we're going to keep an eye on that, and you can click that. We'll do some polls at some point. I think that pretty much covers it. If you have any questions, let us know. You should be able to select whether you want to send something to a staff or the entire audience. And just as an FYI, I am technically Peter today because I'm logged in as him. All right. So we're going to head on down to our next slide. Objectives for today, we're going to talk about 5 ways to integrate primary prevention into your organization, into presentations, and some tips for working with specific grades and class. So, but before we do that, I want you to go ahead into that chat, like we circled before, and go ahead and just put your name and your agency and a hello so we know that you're on the line, you can hear us, all of that good stuff. Great.
I don't see everybody's like you do. Am I doing something wrong?
No, you just got a different screen.
Okay.
All right, wonderful. So I see a whole bunch of people logged in with agencies and names. That's great. So we're going to go ahead and move on. So that we have our part 1 talking about those first 2 objectives, and then our part 2, we've got a bunch of fantastic prevention educators with us today that are going to talk specifically about some of the work that they do in these different school levels, and I decided to call it a Fabulous 5 because Fantastic 4 was taken theme because we're asking people to give 5 tips or 5 themes, and you're going to see that throughout our presentation today. If you have any questions at any point, go ahead and put it in the chat. Otherwise, we're going to jump straight in with some 5 tips to integrate primary prevention into organizations.
Okay. Hear me good again?
Yep.
Okay, good. We'll start by looking at different ways that you can integrate prevention into different parts of your organization. There's not just one place that we can do it, and Rose picked 5, so that's what we're gonna look at. But I think it's not something that you maybe are going to be able to do all 5, that you're going to be able to focus in all of these areas, but it's just some suggestions of where prevention can be integrated into organizations, and we'll try to give some examples of those things. So, how to integrate prevention into your board, into your internal structures, into your personnel, partnerships, and resources. So we will start with board. This is something in terms of the overall vision and organization of your agency, that having your board supporting prevention and engaged in prevention and understanding prevention is really important. So is there opportunities to provide some training on prevention to your board, as well as adding someone with prevention or public health experience into your board that could maybe help with sort of that integration. So having somebody as a part of your board that has that public health background, then you don't always have to be there talking about prevention. Then you have somebody there who is experienced in that. specific to like your structures within your organization. Starting to track and look at data. Data is a real important way that we make the case for prevention, and so that's one way to start to look at your organizational structure that can support your prevention work. It's going to be about intervention to start. Your data is going to be about incidence and prevalence and those sorts of things, which aren't always necessarily linked to prevention, but that data tracking and that data monitoring is a really important part of engaging partners, as well as making the case for prevention and talking about the importance of prevention. Asking folks and looking at, does your mission or vision include a message of prevention? WCASA's mission is to create social change to end sexual violence. So our mission is strongly rooted in a prevention message, which all of our intervention work fits under as well. But that overall mission, that overall goal of social change and prevention is core to our organization through our mission, as well as including prevention goals in if you're doing, I don't know how many people do agency strategic plans, but that would be another place to make sure that, I know at the local program I used to work for, we did all this great prevention work and we were doing a lot of integration, and then the board and some leadership staff went and did a strategic plan that not everybody was a part of, and we got it back and there was no prevention in it. I'm like, hey, wait a minute, where's the prevention? So being really deliberate about those things is sometimes necessary at the beginning until it's fully integrated into your organization. Sometimes you have to be really deliberate to make sure that it's there. Oh, there we go. There's a little delay. The third one is looking at personnel and including prevention in job descriptions of all staff. And that's something we've worked really hard to do in the last couple of years at WCASA, is to integrate prevention into everybody's work. How does Ian's work in systems and legal, how does that support prevention, and how can he talk about prevention in his work, or with Graciela, or it's easier for Rose and I, obviously, because that's the main focus of our work, but for other staff, how do we make sure that prevention is a part of everything that we do? And some of the ways we did that is by including prevention in job descriptions of staff. We held regular trainings on prevention when we were getting new information or new research related to prevention. We were sharing that at staff meetings and talking about it and making sure that everybody was aware of some best practices or new innovations that were coming forward. We always share both with folks on the prevention listserv as well as internally with our internal staff information about trainings, webinars. Lynn is joining us today on this training, but making sure that everybody is aware of webinars that we offer, as well as other partners, Prevent Connect, and other folks. Our regional technical assistance providers are another good example. They all are on the prevention listserv and join these calls, when they're able. And so really making sure that we're all on top of the best information out there related to prevention, as well as if you're doing volunteer training, starting to look at how you're utilizing volunteers for prevention, and are you including prevention in that volunteer training? And I know some communities are starting to look at not just utilizing volunteers for crisis intervention, but also utilizing volunteers for community outreach, for some other work in their community, and that prevention piece is really important. And we also want all our volunteers to just be knowledgeable about all of the topics related to sexual violence. So when there are sort of spokespeople out in our community, that they understand all of our work, which includes prevention.
Great.
The next one is resources, and so this would be an opportunity for you to add information about prevention into, if you do agency newsletters, if you have a website, just making sure those things are visible and present. And I know, some of these things, like I said at the beginning, when you're starting to do this, sometimes find, for me anyway, and maybe it's because I'm sort of a type A personality, finding really tangible ways to do this was helpful. So, deliberately finding a space, creating a space on the website for prevention, and we worked really hard to do that over the last couple of years, as well as including it in our newsletter. And Rose is great about finding, resources and things like that, and has taken responsibility for making sure we've got something, new and innovative to share every month in our WCASA newsletter. We also have worked to incorporate prevention messaging into all of our communications, like press releases and different things like that. So whenever we're talking about sexual assault, regardless of sort of what we were asked to come and talk about, we are still incorporating prevention into those sessions. Even if it's just a slide or just our mission, however we're incorporating it, we're making sure that we're always including prevention in everything that we do.
And also to that accord, I included some of these posters. We know that posters are not going to end sexual violence, but sending some of that positive messaging to make up for the monsters and loads of negative messaging that we do receive every day, and so does our youth and our communities, about healthy sexuality or gender norms. This campaign, and you can see the link, it's in blue in the middle, and you can even click on that. These slides will be available afterwards, so you don't have to take notes. But these are free posters, and I thought that they were really nice. They're targeted towards young adults, but with some nice primary prevention messages. So when I paid for our date, she didn't owe me. I really like this one on the bottom. So when she was too drunk to decide, I decided we shouldn't. So to integrate some primary prevention, getting a little bit of funding, or even just printing these at our agency and handing them out in presentations, or putting them up in some of the schools we present, asking for permission, of course, can be another small way to try to integrate some of that prevention. And here's another campaign. This actually is from WCASA. Again, free to open. And we've got some of copies here at the agency as well. So if you wanted a number of these, you could talk to us. We can mail them to you. This is just one of 3 or 4 different posters. And then this last one that Graciela actually referred to me, which I think is kind of fun, talking about redefining feminism as opposed to the mainstream definition. I support feminism because gender equality promotes stronger families. And some of these are nice. They're not just focused towards young adults. You can see that link again on the bottom. And these as well are free to download and print off. And one more thing Kelly had talked about integrating into different types of releases. We have a sample press release. It's actually from 2010 for Sexual Assault Awareness Month. But we always recommend, if you can have 1 or 2 lines directly related to primary prevention, that can be a really nice way to integrate. So in this proclamation, if you were to read further, and again, here's the link where you can find it, there's some text like, all of us have a role in primary prevention. How? Through actions like treating others with respect or speaking up when someone makes a degrading comment. And again, this idea that every individual plays a role in ending sexual violence. So finding times when we are putting things into newsletters or press releases to get those 1 or 2 statements and moving that a little bit more upstream.
Okay, and then the last 5 of 5 is talking about partnerships. And one way to do that is getting involved in local coalitions that are addressing similar work, maybe addressing prevention, but not prevention of what you normally are doing prevention about. One of the community coalitions that was super helpful for me when I was starting to get into prevention at the local level was our like alcohol and drug-free communities coalition. They were also working under sort of a public health framework, and they were having some of the same data really well, and we started to support each other's work. So I started to come to her meetings, she would come to my meetings, and it was just a really nice way for us to support each other in our prevention work. as well as understanding, the correlation between alcohol and drug use and sexual violence. We had some deliberate ways that we could work together, but at the same time, it was also just good to have a prevention ally, somebody that really understood prevention, who was participating in my community team, and reaching out to new partners in the community doing prevention. And sometimes that means sort of going out of our intervention sort of framework. And I know I came from doing direct service, working on a SART and a CCR, so we were really in that medical criminal justice sort of system framework. And it wasn't necessarily that I didn't continue to engage with those partners, but I found new people within those organizations. So instead of having the sensitive crimes investigator be a part of the prevention work, there was maybe their community policing or somebody else within the department who had a special interest or had a background in prevention. Same with people within, within a medical system. It may not be the ER nurse who's on your SARTs, but it may be somebody else doing some community prevention within the hospital, as well as looking outside of those folks and looking. We're going to talk more about that later, but really looking at others doing prevention, whether it's suicide, alcohol, drugs, other safety-related issues. There's other people doing prevention in communities, even in the most rural communities, there's other people doing prevention. And so finding out who those people are in your community and developing some relationships. And it goes a long way to support their work in them supporting your work. So, and they really can provide a great wealth of support related to prevention in your work.
All right, moving on to our next slide. Give you a second to load. So speaking of that, we know that there are some partners that we tend to work with, especially in those traditional SARTs or CCRs like law enforcement. And we have some partners up here that may be people you're already engaged with or folks that we're not currently. I know that there are some really great examples of folks doing sexual assault work and engaging with exercise community or natural healing, but I don't think that's necessarily the norm. So as we're talking about that, I'm going to go ahead and, like we said, there are tons of other partners. These are just a group of 5 because we've got our fantastic theme. I'm going to launch a poll, so you should see up on your screen asking you which partners you currently engage with, and you can select all that apply. And then once you're done, you go ahead and hit submit. I'll give you 5 more seconds. All right, we'll close and share. So you should be able to see that up on your screen. What do we have here? All right, so it looks like everyone's engaging with community and other forms of violence, which is fantastic. I mean, just the fact that so many of our programs are dual. We're already talking about domestic violence and sexual assault. High partnerships with alcohol, tobacco, drugs, suicide, mental health. And I'm excited to see that there may be some room for growth with that HIV and reproductive health, because Kelly's been engaging with some of those partners on the state level, and maybe she can talk even more about that moving forward. So thanks for participating in that. You should see your screen coming back on. All right, so we can talk easily about engaging with these people hypothetically, just like evidence-based curriculums. Like in theory, it sounds so great to like disseminate them and just implement. But we know that once we start doing these things, we have all of these challenges. Politically, time-wise, finance-wise, maybe we're funded under certain grants that don't allow certain activities. So we wanted to talk about some tips to actually start making those connections or to start those conversations. On this screen, you'll see on the bottom, there's this phrase that says, promoting health starts with preventing violence. And I took it out of the article below because I thought it was a really nice, simple statement that's getting at a lot of what we're talking about. If people say, well, what does this have to do with health? We can say promoting health starts with preventing violence and then talk about why. So for tips to connect, the first one we have is to include data to show how sexual and intimate partner violence impact health, or whatever that other issue is that we're dealing with. I originally made like 10 slides that were overwhelming because where are we going to find this data? And I went through each one of these topics and went and found, some really great documents, maybe 5, 6, 7 for each category. And I have it in a resource sheet that I'm going to email out to everyone on this list after the presentation. So when we're talking about including data, and it's like, well, where do we find data talking about the links between HIV and sexual violence, or things more abstract like nutrition and sexual violence? Like that seems kind of like an abstract concept. You're going to have a nice list coming to you that you can pull out some of those things. So when you start conversations and people say, yeah, I'd love to engage with you, but really, what does nutrition have to do with violence? You can say, oh, let me tell you about that. And hopefully that'll be cool. And some of these articles, like this one right here, and there's the link below, actually have already like put things into a nice box for us. So when we're talking about gender-based violence and HIV, what are some of those overlapping themes or things that we're finding? So just the risk of requiring it. We know that child sexual abuse increases risk. And some other things, substance abuse, emergency conflict situations. So these can be some nice talking points that might already be established for us. 2, focusing on what is shared. So things that you share with people, because since we come from different backgrounds and agencies and, have maybe different philosophies in doing prevention work, everyone might have some things that are a little different. But if we can focus on what we do share, whether risk factors that we want to target or values that we have or things that we want to see in our community, it's going to make it even easier to partner. So some examples, again, this was a dual intervention that I think was done in Africa. Yeah, you can see Limpopo in South Africa, between HIV and violence prevention. And they talked about their indicators, so the things that they measured. These are just 3 of them, but I wrote them in the black box. And if we brought partners from both spheres doing prevention, I think we could agree that these outcomes are important for both of these groups of people. Increasing self-confidence, challenging gender norms, autonomy and decision-making. This is important for violence prevention and HIV prevention. So that's another way to come to the table and focus on things that are shared. I brought up this example because we know that different communities have different priorities, or maybe there's something going on where it's like Sexual Assault Awareness Month for maybe cervical cancer. And you might say like, okay, I know that there are links between sexual assault and cervical cancer, and if this is the main thing that our community is focusing on, and say there's like a big fair happening, or there's this big press release or some kind of a news article, how can I get involved? So looking for things where they're talking about lowering your risk, not smoking, using condoms during sex, and limiting your number of sexual partners. I just found this online, but we know that victims of sexual violence probably aren't getting to have a voice about condom use. And just the fact that that's happening, there is an increase in number of partners. So just that basic knowledge is a really great way to connect. Plus, going back to that resource sheet that I'll send out, you can even take some data to bring that forward. And then third, I know this is a lot going on this slide, youth violence, so talking about like keeping youth out of gangs and safe on the street, and sexual violence. Sometimes the shared risk factors, we know that they're there, are not as easy to find. And I just went to the CDC website and put in risk factors for youth violence and sexual violence, and you can see the web page is up. And then I went through the risks, and I actually found the ones that overlapped and put them in the middle of this Venn diagram. So if I, on the state level, saw that there was a youth violence state coalition and said, how could we partner with them, or we want to partner with them, what could that look like? Coming forward with these things, saying like, wow, we know that these are risk factors for both of the causes that we care about. What could we do together to focus on them? And then I included this cartoon. It says, as you suggested, I made a list of my professional goals. 1, make Ed stop blowing his nose when I'm on the phone. 2, convince Cheryl and Sandra to wear less perfume and get to the break room faster when I smell popcorn. So that might seem not like our topic, but the reason that I put it up is that we know that when we partner with folks, they may have different goals than we do. Probably not these kind, because this is a little silly. But I think, in my experience in doing community work and organizing and prevention across spheres, is that meeting people where they're at can be really powerful. So even if my goal is not one of these three things listed, if I can engage with that partner and I have the time and finances and ability to do that, starting that relationship and forming that relationship can lead to outcomes down the road that can be really, really powerful. So then we just got a few more. Discussing opportunities to collaborate. This is going to be small on your screen. So similar to before, maybe there's some kind of health fair going on, or there's some event that you're like, oh, what could we collaborate on? Not necessarily on outcomes. But this is a cool chart that you can see the site below. Up here, it's real small. There's different acronyms. CM stands for child maltreatment, intimate partner violence, sexual violence, youth violence, elder abuse, and suicide. So if I was partnering with people and I'm looking for opportunities to collaborate, these interventions to the left are things that have been shown through that are evidence-based to reduce the different types of violence. So if I look here, I would say, it looks like under 3, reducing the availability and harmful use of alcohol has been shown to have some evidence across all of these forms of violence. So that could be a really great opportunity to collaborate.
And this might be a place to start too. You know, if you're trying to build more of a prevention community, you know, this is, you know, a good place to say, okay, let's start, you know, bringing some of these, you know, some of these other folks to the table. Again, finding an initiative that is relevant to everybody, and we, you know, we do a lot of that work at a statewide level as well in terms of. You know, I'm on a child maltreatment prevention leadership council, and it's a really diverse group. And when we brought all the research and we started bringing everything together, the one thing that we found that was, you know, relevant to everybody was poverty. Well, there's not a natural. I think those of us, you know, those of you doing the work, you know, you see people experiencing and dealing with an issue like poverty on a regular basis, but it's not like people automatically think poverty and sexual violence, poverty and child sexual abuse. So it sometimes takes some conversation to explain that connection and understand that, but you know, it's a really interesting way to build new partners and to look at a common issue that is also supporting your work but maximizing everybody's time and resources to do some collaborative work as well.
Awesome. All right, and then just on the bottom, some general things I'm sure people are already doing, inviting partners to events and meetings. And I found that the more strategic you can be about who you're inviting and when, the better. So it's very common for us to have like just listservs and newsletters, and we send them out to everyone and our partners. But say I have some kind of meeting coming up, and I'm like, wow, that would be a really great fit for this partner. Maybe I'm going to send them an individual email, not just a newsletter. Or maybe I'm going to call them up on the phone and say, hey, I don't know if you're free, but wow, we've got this going on. It'd be really great to have you at the table. And then offering to provide training, which we do all the time, but more importantly, almost asking for other people to come and provide us with training. I was talking to someone who's a leader in the faith community, and I know we're talking more about health partnerships, but faith communities can be a partnership as well. And I was just talking about, you know, this general idea that I feel like there's not as much collaboration as there could be between, you know, sexual assault centers and people in faith communities. I feel like that could be a really good fit. And we had a really great relationship, and he came around and told me, and he said, Rose, you know, we would be happy to come forward, but you've never approached us. And you're never asking us for our help in the things that we're leaders in, and we can provide to the people who are coming to your centers. And it was really eye-opening to me that doing that both ways can really increase that partnership. Before we move on from this, I just wanted to ask Kelly if there's anything she wanted to share from the reproductive health partnership stuff that she's been working on.
I think the number 5 there, the asking asking for training for your agency. I think that's a way to show like a genuine really interest in your shared topic and your shared work. And I know we've done that with some of our reproductive health folks. You know, healthy sexuality and reproductive health has been identified as a priority for WCASA through some strategic planning, and we know there's obvious correlations between that and sexual violence and access for survivors. And so, you know, we knew that, but then we still had to go out and make those develop those relationships, make those partnerships. And that was one thing that we did is, you know, sitting down with Planned Parenthood, with family planning, reproductive health, with folks like that, saying, how can we support what you're doing, because we know what you're doing is supporting survivors. And so, you know, getting on their work groups, their committees, you know, I'm on a reproductive rights task force, that there's a wonderful collaboration of a lot of different people who are interested in reproductive health issues. I was just up in WCASA at another meeting with folks working with prenatal care and family planning, and really just listening and talking and asking them, like, what can we do that's going to help support your work? We know you're working with survivors. We know survivors are disclosing to you. You're trusted in your community. You're trusted by your patients. You know, how can we do that, and how can we work together? And I think it really shows a level of interest when you actually not just say, hey, I'm the expert and I want to come tell you about why you need to care about sexual violence, but also saying, hey, we need to make sure our staff, and we need to make sure that we've built our capacity related to reproductive health, so can you come and do some training for our staff? And really doing that in a way to build relationships as well as real trust, and build your agency capacity related to whatever that topic you're looking at.
Awesome. All right, so that takes us through part one of part one. And now we're going to move a little bit from organization work to integrating prevention into presentations, because we understand the reality that a lot of folks out doing this work with youth in communities, it's very common for us to get a call and say, hey, can you come and do this one-time presentation? Or, you know, we really want you in the schools, but we've only got 30 minutes to have you present. So we recognize that there are a lot of limitations to that, but maybe there are some little things we can do to start pushing those presentations upstream. So this is them quickly bulleted, mainly so that if you want to print them out or have them handy, you do. But we'll go through each one individually, so I'm going to blow past this. And the first one is to provide tips or just give a handout on what you can do to prevent sexual violence. And I think that this is a really nice way to end presentations as well, because this topic can be, as we know, hard on people, triggering to survivors, and ending on this sort of positive, like, hey, everyone has a role, also engages men in our audience to feel like part of the solution, which is really great. We have a bunch of options up for you on the screen. I know it's a little busy. To the right, this document right here, actually, here, let me grab a pointer. Blink. Right here, this Forward Wisconsin initiative can be found on this link, and is talking about things that folks can do in different agency positions. So if they're a government leader, if they're a healthcare provider, etc. So that's nice for specific work. Jackson Katz has provided a 10 things list that men can do, which is down here, translated into English and Spanish. Also, through Jackson Katz's MVP program, there's a list of 10 things that anyone can do, men can do, or women can do. So depending on what audience you're in, that can be good. And then there are 10 ways that are adapted from our California coalition, which I sort of liked as well. Yeah.
And I think that it's important to, you know, sort of slide these things in. I think a lot of times, I know I've gone to different, we were just having this conversation actually at our meeting, is we go to talking about poverty and we go and learn about it and we understand, man, that's a really important issue and it's maybe not something I've been engaged with previously. And I get educated, I get engaged, and then they're like, okay, goodbye. Have a good day. Thanks for coming. You know, and it's like, wait a minute, like, yeah, I can donate to my food pantry, you know, but give me those things. Like, let me know, you know, I think thinking about sort of having a small call to action in some way with everything that all the community outreach that we're doing. And this is one way, and a simple way that's already been developed into a nice little handout and has already been created. I know I used to use slides like these at break time. If I was doing a longer presentation and we would just get to a break, my break time slides would be one of these 10 things that people can do. So it's just sort of sitting up there. It's not even content that I'm reviewing, but as people are walking into the room, I will have tips that you can do and sexual violence in the morning. If you take a 10-minute break, have your break time slide be some different messages. You can have it, cycle through some different posters or, different messages. You can use these handouts and just have the 10 things listed. There's really simple ways to incorporate these things. And I think, again, we want to engage people, and giving them really tangible things to do is one way to do that. Because, again, people will say, man, that's really important, and I should care about that, and I didn't realize this was going on in my community. Well, now what do I do with that? And giving them something to do with that is really, I think, really important.
Great. Thanks, Kelly. So here was a list that I gave as options, and at first I was like, this is great, and then I'm like, maybe I don't totally love all of them. So I also want to give you permission that when you find these lists to go ahead and edit them so that they fit well into your community and they may meet your needs. But what I did like about this list is some of them were very simple, like know that silence does not equal consent. We talk about that a lot in presentations. Simple. Interrupt rape jokes. Teach everyone you know about the myths and realities of sexual violence. That was one I was a little hesitant on because I was like, everyone, maybe not appropriate with all people in all settings. But number 4, talk about primary prevention. Do not use alcohol and or drugs to get someone to have sex with you. I mean, we're getting really far away from hearing a rape whistle, which is, I think, really positive for lots of folks involved. This is a way to address specifically intimate partner violence by different types of healthcare providers. And I think some of them are upstream, some of them are secondary. Again, another list that might be useful, and that link is down below. So that's number 1. Number 2, and those of you know whom you will laugh seeing this, is incorporating data to make the case for prevention. Because there is so much societal pushback and there's so much victim blaming, I think it's super important that as educators we're really on our game about the data we use and the statistics and where they come from, and that we use them in powerful ways to really address the issues that we're getting at. So I kind of think of using data for prevention in 2 ways. So number 1, where's my awesome pen? Is right here. The idea that people are not going to be inspired to change violence if they don't even think it's a problem. And we know that even here in Wisconsin, there are plenty of communities where if you give numbers like 1 in 5 women may have experienced sexual violence, they'll just look at you and be like, really? Really? It's that high? Are you sure? So using that prevalence and incidence to say, 1, we have to prevent it because it is a problem. The NISFIS survey right here is some of the most up-to-date data that we currently have, and it also provides state estimates, which is nice. So you can even say, in Wisconsin, we know that 17% of women will experience rape or attempted rape. There's also violence talking about men, too, which is really great. I do give some hesitations using that survey because the way that they measure violence against men is a little tricky. They just look at rape as penetration, so it comes out as something like only 1 in 72 males have experienced that. And then they talk about sexual violence, which is on the other spectrum, all the way to sexual harassment and jokes and that kind of thing. So I would be hesitant and think critically about the stats used for males. And then we also have some youth data in Wisconsin that you can find here that's talking about sexual violence that youth have reported, sometimes within our own communities, and you can find that data as well. Then number 2 is using data to make the case that there's a solution. So the idea that even if people think there's a problem, I've talked to folks who say, gosh, it's really sad that sexual assault happens, but can we really prevent, like, are we really going to be able to do anything? Or maybe we can make it a little better, but we're never going to completely end violence. That's just a part of our culture. It's the way it always has been, the way it always has been, or will be. And I think it's really wonderful when we can step in and say, we know we can make a difference. And to give you some information, our Veto Violence has some success stories broken down by topic: sexual violence, intimate partner violence, child maltreatment. In addition to, let me go to the next slide here, to some actual data from programs that you'll see pop up. And I know there's a lot of text, but it's because I wanted you to have this for when you're out in your communities that you can even just copy and paste. An example I put in red was that researchers found that young women who had not participated in a school-based prevention program were nearly twice as likely to have experienced child sexual abuse as women who had participated in a program. So we want people to know this. Like, we want people to know that prevention education can lead to success, that, you know, our middle program is more recent, from 2011. Alan Berkowitz, I saw him present and talk about this, saying that, you know, he did this rape prevention program with men in college and used some really great research and a control group and all that stuff, and found that at the end of this, men were using less pornography. They were less likely to hang out with aggressive peers who, you know, were doing sexually aggressive behaviors. And most importantly, they were less likely to engage in sexually aggressive behavior. So this is exciting. Like, we know that violence prevention works, and we want to make sure that we use data to share that when we're out making the case for this in our community and engaging partners. I know that numbers and that doesn't always connect with every community, and this is kind of a nice infographic talking about how violence is preventable, showing different levels that it can be happening on, and then interventions that have been shown to be successful. So, for example, we know on the relationship level, that's that second one, that a risk factor is male control over women. Not the only factor. Something else I like about this infographic. So what are we going to do about it? You know, there are programs targeting men and boys to promote gender equality and behavior. So this is kind of a nice way to present information to other audiences. I'm going to hand it over to Kelly.
Okay. We're in number 3 of 5, our fabulous, phenomenal, I don't know any other, 5. Another way to start to include some prevention-related topics into your intervention presentations is to talk about the history of violence against women. And there's a lot of resources here listed on the slide. Again, a lot of information, but we wanted to at least get you all of these different links. And as a just in terms of this history piece is, I think the prevention piece and the history piece come together because it really gets at some of those root causes, as well as it gets to some of those structural pieces. And I think that's very important when we're talking about prevention. So really understanding that the history of violence against women is rooted in equality in our society, and getting people to, I think if people aren't knowledgeable about sexual violence, they may be knowledgeable about history, so they may connect to this movement, because of that purpose. And really understanding how this history is also linked to other things, to other things in history. So looking at where the race crisis movement sort of fits into other social justice movements and how they're linked to that, as well as looking at history, the history of violence as a public health issue. And I think we're just starting to really talk about violence as a public health issue and why that's important and why people need to care. And for me as an advocate, it makes it less about the victim in a good way. So if we're talking about violence as a public health issue, as a structural, historical issue, it becomes less about how she dressed, what she was drinking, where she was, what decisions she made, because we're looking at it from a historical perspective, as well as a public health issue. Violence is a public health issue. It needs a community solution. You know, we all need to be a part of that solution. We need to all take it seriously. Like, it's a really nice way, to engage people around the topic.
Okay. And this is actually a picture of the webinar that Kelly referenced earlier that was done here at WCASA that you can see and glance through, and there's a timeline as well.
And the other thing I will just say about the history piece is it also reminds us that we've come a long way, but we're not as far removed from that history as we'd like to be. You know, when we look at the history of the evolution of laws, you know, protecting people from sexual violence, you know, whether it's marital rape or whether it's, you know, other legislative initiatives, I think those things are still very recent in our history, and so we have to, it helps to sort of embrace that and know that, and know that in terms of rape culture that it's going to take some time for us to really have the level of change that I think we all want to see in this movement. Moving on to number 4, and I sort of alluded to this in the history piece because they are very related, is really facilitating discussions and activities that really get at those root causes of violence. And the site that is here is some exercises from, it's listed as WCASA Now End Abuse website around ways that you can do that. So how do you engage people to talk about root causes? Because again, I think both from prevention and intervention, that's a really good place to start, and it's much less victim blaming, and it's much more prevention focused when we start to look at social norms, or when we start to talk about oops, my screen went away. When we start to look at bystander intervention, and really looking at, there is some research that talks about root causes of violence, but some of those may be different and rise to the top in different ways in your communities. You know, you may have one of the norms may really rise to the top in your community, whether it's because of your population, or maybe some things that have gone on in your community. You know, this is a way to sort of get at those root causes and what people in your community think about those root causes and how they understand them.
All right. And then in some ways similar to root causes, because oppression is a root cause, really trying to incorporate discussion on intersections of oppression. And, you know, I say this with the caveat that this is really hard to do. And depending on time, it might not be appropriate. If you only have 2 minutes, you might not want to open up a conversation about race or class or socioeconomic status. But if there is the opening and there is the place to do that, I've got some sites up here that have some nice, like, engaging activities that can kind of start those discussions. Some exercises on the right. You can see kind of what they're talking about. Step forward, step back, maybe something that you've done before, where you sort of have everyone stand up in a line and say, you know, have you ever had to worry about getting food to make it through the week? Take a step forward. Do you know someone in your family who's in prison? And, you know, like I said, that you have to really think about your audience and if that's a safe place to do that. But it can be a really nice way to start that discussion, and then taking it a step further and say, well, what does this have to do with sexual assault? You know, how come someone who is further down this line and has more of these other forms of oppression, how does that impact their risk or their likelihood or their recovery process? We know that's a little less primary prevention focused, but still important to talk about. And this is something that I really like, that I've used, because it's more of an individual activity, and we know that people are at different stages, so they might not be comfortable talking as openly about it. But having like pencils or pens or something colored, and asking people to take this flower, and if they think that they have privilege in whatever category this is, so one says sex, one says religion, one says social class, then they're going to go ahead and cover the entire petal. the outside and the inside. And if they think that maybe they have less privilege, they're going to color in just the inside. And the thing that I like about it is it allows people to choose where they think they fit. So if I speak English in America and I think that that's a limitation, I can put that on my own flower. And it's also talking about how oppression fits in many different forms, and it's not just about one of these categories. So it's an exercise that I like doing with folks. I bring these posters back because another way of talking about intersections of oppression is to make sure that we're competent and we're culturally competent in the areas that we're serving, and trying to bring in messages and pictures that look like the people we're serving, and not just look like them, but meet those messages and needs. Anything else, Kelly, on that?
I don't think so. I think they've heard enough.
Yeah, oh my gosh, lots of talking. I feel you on that. So we're going to go ahead and take it into part 2. Like I said, I know we've got a lot of material today. And before we do that, I'm going to throw up another poll asking you, it'll take me 1 second here, this question that you see on the screen. It should be popping up in 1 second, saying what grade levels do you present to or currently work with? And you can select all that apply. And once you do that, go ahead and hit submit. I'll give you 5 more seconds. Or a little bit more. I can see how many voted. Okay, fantastic. I'm going to go ahead and close that and share those results with you so you can see. So we can see that middle schools and high schools are the highest level, almost 90%, followed by university and college, and then elementary school and pre-K. So the great thing that I'm hearing is that the people who are on this webinar have a wealth of knowledge. So if there is something that you want to share, it's going to be easiest for us, although a little bit scarier for everyone else, if you go ahead and raise your hand or ask me to unmute you. You can try to type in the chat, but the way it's set up in this program is only I can see it, so I'd have to copy it and paste it and put it back into the audience. So yes, thank you for sharing that. I'm going to go ahead and unmute Denise. She's going to be our first presenter, and she's going to talk about some of the work that she's done in elementary schools and 5 tips on that sector right there. So Denise, you're unmuted. Go ahead and say hello.
Good morning.
Awesome. Perfect.
Can you hear me?
Mm-hmm.
All right. So thank you for giving me this opportunity. Do we have the slides that I gave you up?
Oh, I'm so glad. So I don't see the poll on my screen, so I can see the slide just fine. Thank you for saying that. Kelly was like kind of poking me like, hey, these things don't look alike. This is why it's good to co-present. Yep, so here you are. You should be seeing a picture of Denise.
And that's my level of technology help. These things don't look alike. That's all I can.
Well, again, good morning to everybody. And that is me far away. It's the only picture I have here at work of me. So I'm the prevention coordinator here at Family Support Center in Chippewa Falls. I have worked with a lot of different kids. Probably the most time I've spent with middle schoolers and high schoolers. But this last school year, I was in the elementary schools doing our prevention education. So I'm drawing from that, that experience. I think this is a great idea. I'm always looking for tips in how do we interact, what content do we use. My experience, I should say, is mainly with classes, so that we typically have 3 to 4 days with a class in the elementary school level. So I'm speaking a little bit less about the one-time presentations, but I think some of the things that I'll mention will work for either a one-time presentation or if you're going into a class for several times. So if I can have my slides, I'll go through the tips I pulled out.
Mm-hmm. They should be uploading in just 1 second.
Okay. I mean, there's so much to say, and I think part of the thing you have to start with is to know who your you're working with. So the first tip there about speaking with the school counselor or the teachers, you know, they're your best friends. They know the kids. You need to be in their good graces and work with them. So they're also the source to find out if you're going to be talking to any kids who have been affected by sexual violence, or, you know, if you're talking about dating and relationship violence, or are they going to be challenging in that they need special techniques used so they'll understand? Do you have a bunch of kids who are going to be, you know, twitching in their seats because, you know, they have ADHD? You need to know that before going in, because it can sort of make or break your presentation. The other thing about talking to the counselors or the teachers to know your kids is to make them feel part of it. Sometimes I felt like teachers were a little, territorial. Most of the time they were very welcoming. They were very glad we were there, we were doing the presentations that we were, but there's, you know, you are on their turf, so it just sets the tone that, you know, you're grateful to them, you're happy to work with them, and they can give you all kinds of important information. Again, before you go in, I think it's important to just be aware if there's anything going on locally or maybe even nationally that the kids might have heard about. Recently, we had, in the news, we had a 12-year-old girl who committed suicide. So the woman who's now doing prevention education in the schools, you needed to have that in her head in case she was going to get questions or the kids were upset by that. So it's, you know, just being aware of what's happening, especially if it's happening in that school that you're talking to. So tip 2. This one is really hard for me. I want to tell them everything. You know, I want to make sure they get all the information. But realistically, if you get a few simple points into their heads, you are gold. You know, I mean, that's all you could hope for. And be fine with repeating yourself. Make it simple. Tell them what you're going to tell them. At the end of a presentation or at the end of a class, ask them what were the points, what do they remember, so that you can tell if they didn't get it. And if they repeat it back to you, then they're just sort of, you know, reinforcing that it's in their heads. So really, really boil it down to very, very simple points. You know, obviously as you get, you know, upwards in the grade levels, you can give them more information, but still, kids are not going to, you know, anybody will not take away very much, realistically. And then one way to help them take away what you want them to is tip 3, and that is have a, you know, a large toolbox full of techniques. You know, some kids are good looking at, you know, things. Some kids are good at doing hands-on activities. Partly it depends on the age level, the grade level, and I'll talk about that in a second. But partly it's just we're different learners. So really if you're good, especially if you're doing classes, put together a number of things so that you might read a storybook or tell a story. Stories are great to get people involved and emotionally, you know, connected. Older kids can do role plays. I've even had, you know, kindergartners and first graders do role plays, where if you're working on skill building, like you know, being assertive, they're good at that, and that's the way that they really incorporate those ideas into their heads, those skills into their heads. Older kids, this was actually a tip I learned last year from teachers. 4th and 5th graders like to do worksheets together. So you get them in a group, you get them focused on a particular worksheet, and they enjoy that. They get to interact a little bit, but then they're working. And we also include a lot of video pieces. And to be perfectly honest, some of those video pieces are so we have a little downtime during a class. If we're going there multiple times, it can be really absolutely exhausting working with kids if you're doing this really intense material that we do. So, you know, a video piece is really good. The internet is chock full of stuff. YouTube, you know, has all kinds of really good good pieces that are short but really effective. So, and it mixes it up. You know, the kids are used to looking at videos, so it speaks to what they do normally. Tip 4, one thing I had to learn, I'm used to teaching like middle school, high school kids. I wasn't used to teaching little ones. And they're very enthusiastic, and they all want to tell you an answer to your question. And it's really hard to stop them. So you can limit responses right from the get-go by saying, I want 3 answers. And then, you know, when you have your 3 answers, you can say thank you and go on. Another technique to kind of make things move along is to either have the kids put their names like on a, you know, a desk tent, or in some of the classrooms for the little kids, like, you know, first graders, second graders, they would have the students' names on like popsicle sticks or some sort of tangible thing that, you know, or sit in a bucket. So you could pull out, you know, one after another of these things and call the kids for a response. And that way you can keep better control, you know, manage the classroom a little better. And I found the kids were very good when they were waiting for their names to be called. They quieted down, which can be a real challenge for little ones. Tip 5, really get down on the kids' levels. I think most classrooms are set up like that anyway. You know, they've got the tiny little chairs, and you can sit on there, so you're not towering over the kids. But you get down on their level. For the older kids, the 4th and 5th graders, like I mentioned before, they like to do group work. They're very social. They like to chat with each other, and they could do that and do the work at the same time, so everybody's happy. But I think sort of just to sneak in a 6th tip, I think the thing that the kids are responding to is your level of enthusiasm, your level of showing that you enjoy being with them. And so, you know, you get down on the floor with the little kids, you know, they like that. You know, they get the sense that you're really there for them. So I think in all the ways that you can, show that you are there because you like kids and you want to help them, you want to protect them, which is a good thing because they'll listen, they'll be more responsive. It will also generate more reports from the kids, which is something that I think you have to sort of prepare yourself for and know what to do with that school. You know, how do you report any kind of abuse? What should the steps be? How does the counselor get involved? So, but I think the starting point is just have a good time and show the kids that you want to be there. So hopefully I didn't talk too fast, but enjoy. It's a wonderful age group, I think, talking to elementary school kids. So thank you very much.
Awesome. Thank you so much,
And that's all I have, Rose.
Denise. I think that's fantastic. If you have any questions, feel free to put them into the chat. We can save them towards the end and open up all of our speakers. But for now, I'm going to go ahead and move on. We technically have Helen Copresent was going to talk about middle schools, but I mean, bless her heart, she has been trying this whole presentation to get the technology to work, and we just haven't been able to do it. So I don't know if Vicki and Jessica, you'd be able to go next. I'm going to unmute you, and you can just tell me if you're good to do that. Vicki, you are unmuted. Jessica, you're unmuted.
Yes, I'm fine.
And Denise, you are remuted. What do you think, ladies? Yay?
Yes, I'm fine.
Sure, that would be great. Awesome. Thanks so much. Okay, so I've got you up right here. All right.
You want us to talk a little bit about ourselves first?
Yeah, just a real quick intro would be great.
All right. So my name is Vicki Bean, and I work with Sexual Assault Services of Lutheran Social Services in Burlington and Racine. I'm the Rural Services Coordinator and Psychotherapist. So I don't do a lot of like the younger kids. I do a lot of middle school, high school, and then like adults. I do things like in the prisons. and things like that, and or college age, kids or people who are older. So that's a little bit about me. I've been with the agency about 10 years.
Awesome, thanks. Okay, and my name is Jessica Lind, and I'm the program coordinator of the Sexual Assault Victim Services Program here at the Women's Community. And then my other hat is that I'm the North Central Technical Assistant Specialist for WCASA, and I'm located here in Wausau. And I've been with the agency for 17 years, and I do presentations at all different levels, elementary, middle, high school, and college, as well as the adult population. Awesome. Thanks, ladies. I went ahead and advanced your next slide. It might just be 1 second for it to pop up. Okay, so we were asked to talk about high school and some tips, because sometimes this can be a challenge when you have lots of rowdy high school students. So our first tip is to be active. Really, both Vicki and I talked about this, and we both use activities within our high school setting. Lecture style is not great, I think, in any setting. Certainly sometimes in the adults we have lecture, but even adults need activities. So with high school students, I think it's really important to offer some type of activity where they can get up and move around, or they have some type of game that they would play. So something that we do is we use a scenario, and we ask them to get up and stand around the room in different areas in which they would stand in a section, for example, that they believe the sexual assault victim in this scenario. We kind of do some myth busting, and so we ask them to stand in different sections of the room based on what they believe, not what their friends are standing in, and then we ask them to do a debate. And so it really gets some good conversations going, and that's where we're really able to listen to what the students are saying and then come back later and really do some myth busting, because we know that there's so many myths that are hidden within sexual assault. We also use current events and current news articles, YouTube videos. We used the Steubenville case when that hit, so that was some really great bystander education. And so really using current events and social media, I think, is really important with high school students.
I feel like there's not a whole lot to add to that, other than I always do some activity that gets them moving around. Like usually I do start off with like reviewing like our services a little bit, or definitions or things like that. But I always quickly go into some activity that gets them moving around. I find if they're just sitting there in their chairs, they're less likely to raise their hands. But if you get up and you have them move around and go stand like under yes, no, maybe, or is harassment, not harassment, or unsure, or those sort of things, if you get them to move around, and they're much more likely to communicate and to talk and to have a discussion. At least that's what I found a lot with high school students. So that's one of the reasons that I think it's so important for me to use activities. I do also use, I have with high school students use the activity called Walking the Walk. I have a high school teacher who all the kids speak in her English class, and she has me and the same nurse come in and talk. And so the first day is a little bit more like conversations about the impact of sexual violence, and how in the book Melinda, how she was impacted, like what were the impacts of that. And then the next day we do the Walking the Walk activity, and they really do really well with it. So I'm pleased with that. So going on to tip 2. I feel like one of the things I find sometimes with all presentations, but sometimes, particularly with high school age or adults, is a lot of times I find that they're always trying to find out like a situation or a scenario where it's like they want you to admit, like, yes, that's okay in that situation, or yeah, that's not rape, or that, that sort of thing. And so to be prepared to, to answer some really difficult questions, I think high school students can really kind of throw some things out there that can be really hard. And so what I find is helpful for me is just to be really consistent, have like a short, quick little, short answers to that, or short things, and kind of go back into the definitions. Like sometimes, like going back into saying, like, it's a, if there's no consent, then this is a sexual assault, that kind of thing. So going back to my original definitions, back to that. Jessica?
Yep, I agree. And I think oftentimes because our topic can be so difficult in terms of talking about, what is sexual contact and what is sexual intercourse, a lot of times students, will still giggle and think it's funny. So, of course, just reiterating those definitions and that this is a serious matter. And a lot of times the students, depending on the age, whether you have freshmen or sophomores, sometimes we have juniors, depending on where they fall in the health class. That can be sort of difficult in describing some of those things. And I think it's just important to let them know that these are serious topics and that they need to understand the definition to understand what we're teaching. So. Okay, so we can move on to tip 3. So again, I think it's really important to be open-minded and really listen to the students. And something that I think is important is to set this up is to really talk about some guidelines before you start teaching the class. And so something that I like to say in the beginning is that someone sitting in front of you, behind you, or next to you may have been impacted by sexual abuse in this very room. And so I ask the students to please be respectful as they're asking questions, making comments, and as they're participating in the activities. And so we certainly talk about, how many people could be impacted, and that's just a nice segue into giving some basic statistics about sexual violence. But I invite them to do this so that they can be respectful of their peers as well as of me, and then to be ready for students to disclose any possible situations. Maybe they talk about it in terms of I have a friend who was impacted, but they may be talking about themselves or truly talking about a friend or maybe a family member. We've had several students approach us after class to talk about their own personal situations. So just to be really in tune with some of the students, you might notice students who are getting tearful and checking in with the teacher, much like at the elementary level. I think it's important to check in with the teachers about what, if any, students might be impacted. But then I think it's important to be listening to students when you're doing those activities, because you can come back and really do some myth busting, because students really believe these myths. And so use what they are saying in their activities and in your activities to really teach and do some of that myth busting. Vicki, do you have anything to add?
Yeah, I just would agree with that. I feel like this one sort of ties into like what Denise had said about it's really important that you want to be there. Teenagers will really, I feel like really, if you don't feel like you want to work with teenagers, or if you struggle with teenagers or the things like that, they're going to really pick up on that. So it's really important that I feel like that you enjoy being with teenagers. I personally like working with teenagers because I find them very energizing, and so I think that that's really helpful to do that, and that it's really important to listen to them. I also really like Denise's tips about I'll need 3 answers, because I do find that sometimes when you do the activities, they all want to share, and then so that can be like a time management issue, and so I think that's a really great tip that Denise offered with, I want 3 answers for this thing. And so I think that was really helpful. But I always try to, if they want to share, I try to listen to that. So I guess that's all that I could add at that point.
And then I think just thanking them, just real quickly, just to thank them for sharing. So I think that's important too, because then it encourages other students to share as well.
One of the things that I find that can be challenging, especially when you're doing the activities, which I still think are really important to do, is that sometimes they start to have a lot of side conversations. So they're over here in their group, and they start to have a lot of side conversations. So it gets to be really noisy, and they start to talk a lot, and then it becomes really hard to, to talk over them. It's not helpful. And so what I found is really helpful is I just sort of stand there, and I'm just really quiet, and they always quiet down right away when I do that, and they get each other to quiet themselves down. For that, I have in the past also used a banjo or a harmonica, a little fun little thing to ting, to get their attention, to kind of come back, okay, quiet down. time to quiet down. So anything that you do with that, Jess?
The only other thing I would utilize is the teacher.
Mm-hmm.
If it were to get too rowdy or kind of coming back to regroup, we could certainly utilize the teacher if need be. I do recommend that the teacher stays in the classroom because that does help. Some teachers will want to run errands around the school or do other things, and I do think it's really important that teachers need to be in the classroom in terms of providing feedback for you on how you did as a presenter, what if anything you missed or may need to cover, and then it also helps in terms of follow through in their presentations, because a lot of the teachers will utilize what we say in their curriculums, and students are often tested on the things that we say. So I think it's really important to connect with the teacher to find out what they are testing on in terms of what you're presenting on. For us, we do a 4-day curriculum in the schools, and so we really have to follow with what they're testing on, and that we'll make sure we're covering that. So tip 5 is providing participation incentives or rewards. And so one thing we also do is work with the teaching staff. Generally, as many of you know, as nonprofits, we don't always have a whole lot of extra funding to order fun things to give away. So if we don't have funding, we try and come up with some things that we can do to provide some kind of incentive or reward if we're really stuck. So we don't do this all the time, but say you've got a class that's just really quiet, generally first period tends to be very quiet at 7:45 a.m. because no one's awake. So sometimes we'll use what we call reward bucks, and they're in the shape of a paper dollar, and it's something that the school district provides. And so the teachers will generally hand out reward bucks for people to participate. So they will just give us kind of a stack of them, and we can give them out, with our discretion to students. And so it is kind of equivalent to so many bucks that they turn in. They would get extra credit or maybe apply points to a paper or a project that they need extra points on. So that's something that we utilize. Other things you could certainly do would be, handing out agency pens or, things that you might be able to order. We have used candy, although we don't always like giving out candy, but we have done that in the past if we have money in the budget.
This is not something that I have used. Now, when we did used to have a group that we did in the middle schools and high schools, and so that was like 8 weeks. That was like an 8-week group. It was like a primary prevention group that we did with young men in the schools, middle schools and high schools. And for that, we did provide like food. I always, brought food to that. So like we had, that was important to do that. When we do our presentations in the classrooms, that's not something that I have done in the past. What I do try to do sometimes is like tie it in some ways to like sort of like, I don't know if you want to even say it like bystander intervention or just participation, but if I have some class that's really quiet and somebody does speak out, or if there's, like if I have 3 areas where they can stand and there's one person standing there by themselves, I talk about how much courage that takes to do that, to stand by themselves. And so I try to tie it in that how much courage it takes to stand up against sexual violence and things like that and to speak out. And so I try to use more like praise in a way, like this takes a lot of courage to speak out about this, and that so that's kind of what I do. So when somebody, if it is a really quiet class and somebody finally does sort of jump in and share, I talk about like, that courage, and that it does take a lot of courage to do that. But I do provide the incentives with the groups in the schools, the long-term things. And so obviously we kind of messed up. We were supposed to only do 5 tips with the fabulous 5, but we jumped in and put a sixth one on there. I think Jessica pretty much kind of talked on this, is that I do think it's really important for the teacher to also stay in the class because I think that it sends the message that they also think that it's important. Like I do a lot at the Burlington High School, and it's with the guidance counselors. It's not with teachers, but I have some that are really involved and active in it, and then some that are not. They kind of just sit there and let me do the whole, it's kind of like, oh, this is a break for me kind of thing. And I think that the class, I feel like the classes that the guidance counselor who is much more involved in that, they're more likely to sort of buy into it too. That if they, if they, I don't know, I just think it really is important to have the teacher there, as well as if there is somebody who is really, out of line. I feel like it's up to the teacher to discipline, to like ask that student to leave or whatever their responsibility. I don't feel like it's my responsibility to provide the discipline in the classroom. Okay.
Yep, I agree. I think just being able to have that teacher support is so important, and really meeting with the teacher beforehand to discuss the materials that you're going to be covering. This is especially true in parochial high schools. I found myself in a really bad situation at one point where I wasn't informed of what I could talk about and not talk about. So it's really important that you talk with the teacher and have conversations about what you're going to be presenting before you present it, and just make sure that you have their support in terms of how you're teaching the class, the activities you're doing, those types of things.
That is it, I think, for us.
Great. Ladies, thank you so much. Really appreciate you coming on and taking the time to do this. I went ahead and muted you back. And I'm going to go back and pretend to be Helen. I'm going to warn you by saying that there is no way I'm going to give justice to the things that she will say. But the one thing that's positive is on her slides, if you picture a PowerPoint, there's like that place for notes on the bottom. And she actually provided some really great notes. So I'm going to go through them quickly, but when you get the slides, you'll actually be able to see them and read them and review her tips. And I also know she's very opening and welcoming, and if you had any questions or follow-up points on these, you could go ahead and reach out to her. So we're going to see, again, a few common themes with other topics and grade levels, this idea of getting connected to parents and the school. She said that for tip 1, it's important to send permission slips home to all parents regarding the fact that we're going to go in and talk about prevention, and also allowing for an opt-out option so that if they don't want their kids to participate, they can do that. And if possible, to include an outline of the presentation and the information you're going to cover. Same idea is talking to guidance counselors or teachers about any backgrounds and things that they should know about kids. Oh, sorry, it sounds like I may have had some sound issues. All right, tip 2 is to target to visual learners. And one of the ways that she talks about doing this is that since most middle schoolers are really visual learners, actually most of us in general, she'll actually take out the school binders or agendas, so that it's like the little manual that they're given at the beginning of the year, and she talks about how the school has a sexual harassment policy in there, and that many schools have this as well, and that a lot of students aren't aware of this, don't understand the policy, and teachers also will talk about how it's really rarely discussed. So she said it's a really nice segue to read through that policy, review it, and it leads nice into discussion about bullying as well. The next tip that she gives is to incorporate stories specifically to that age group. And she says this is impactful. If you don't have one from your agency, using recent news also works. Recently, the news has reported the suicide of a middle school girl who jumped to her death because of relentless bullying by female peers in her school. The case is being investigated to perhaps legally charge the 7 girls who taunted and bullied her using technology, cell phones, and the internet. She talks about how this is a great opportunity to connect choice and consequences. And I do agree with that. I think the more that we can have stories related to our audience that, hey, this is something that happened here in Wisconsin or in this age group or, in this county, the more engaged we're going to have kids and other presenters. Her next tip, a common theme we're also seeing, is to move around, role plays or other interaction. She says we do a role play called Take Me Seriously, which focuses on passive, aggressive, assertive behavior, and we ask for student volunteers. Students will make a large circle in the room and divide into a circle as you would a pie. She asked each student to take a turn walking to the student on the opposite side of the circle and say, "I want you to take me seriously." Then there's discussion about how close you may or may not get depending on how well you know the other classmate. Is it easier to do this with the same sex? Are boys taken more seriously? Do some command your compliance? Do some people command compliance by their use of voice or their body language? And using this discussion to talk about boundaries as well. So I'm sure if you want more discussion on that Take Me Seriously activity, you can reach out to her for that. And lastly, to promote social awareness and curiosity. She says, believe it or not, this group is concerned about values and unfair treatment of others. If there's an opportunity within your organization, see if you can explore their gifts. Using poetry, skits, club projects, etc. She says, we have a booklet called Take Time to Listen, Make Time to Talk. It's reproduced with ABC's permission. Students are asked to take the book home and have conversations with their parents over dinner. So that's nice too because you're getting into a relationship level as well. In the books there are questions like, do you feel safe at school or work? Describe the perfect boyfriend, girlfriend, husband, wife, mother, father. What makes them that way? If the student does the activity, they return the signed slip at the back of the book and are rewarded with a pizza from Pizza Hut. She said, yeah, this requires some work ahead of time to make that happen. And one other note, she said, students that speak out, in quotes, often create great opportunities for really rich conversations. Oral sex is a big issue for 8th grade students, and a lot of them are unaware of some legal ramifications. So find out what topics are off limits in your school communities if these things come up, which Jessica was also talking about doing that as well. So again, not justice to the work she would have done, but some really great information that Helen is bringing in. So we got one last speaker for you. I think we may go a few minutes over. I understand if people have to leave at 11:30, but I'm going to go ahead and I encourage you to stay on. I'm going to unmute Ingrid, and she's going to talk about some work in colleges and universities. And you should be unmuted now.
Okay, hi everyone. Can you hear me?
Yep. Sounds great.
I'm Ingrid Peterson. I'm the Violence Prevention Coordinator at UW La Crosse. Thanks for inviting me to be part of this. A lot of the tips I put up really, I think, have been covered by other speakers, but I'll just address a couple of things that maybe are different at college. One of the things that we've done on the topic of making it interactive is to purchase these clickers. It's a small remote control type device. You get like 50 or 100 of them at a time, and that enables you to build a PowerPoint presentation that can be interactive and similar to the polls Rose just put up, where you could ask students a question that you might not want people to raise their hands to in a class, like how many of you do know someone whose life has been impacted by interpersonal violence? And people can respond really anonymously, and then the poll goes up on the screen. It lets you see that. So that's a nice way to do interactive presentations. Now, these are not inexpensive. I think I paid $1,000 for my set, and they told me I was getting a UW system discount for that. But there are also cell phone apps that do a similar thing. I'm not real familiar with those, but you could Google that. I've seen a colleague do that. So assuming that many college students and even high school students are going to have a cell phone on them in class, you can have them set their phones up to do a similar kind of polling thing. So that's one kind of fun thing to do. We also make a lot of use of scenarios, breaking students into groups, looking at different scenarios. And typical topics that are popular at college, besides giving the general information that all of you talk about as well, are we like to focus a lot on bystander intervention. And how people can intervene in situations. This is nice because we can expand it beyond the very basic, like what do you do if you see someone trying to get a drunk girl to leave a party with them, and talk about other situations, like what do you do when you see someone being harassed for their gender identity, or what do you do when someone has had so much to drink that it's really a medical emergency and someone should be calling 911 but no one wants to get a drinking ticket. So we expand beyond sometimes our basic issues and just talk about that issue of how to be good bystanders. We really try to encourage that on our campus. Information about healthy relationships is really popular, and one of the things we do a lot is hand out a healthy relationship quiz we found online that comes from the Boston Public Health Commission. And it's a nice one because it's relatively simple, and then it allows them to score their relationship and just kind of look at whether there's areas they might want to take another look at. And another really popular topic is involving men. in this work. And so that's on campus. Students are often looking for ways to get involved. We do have a men's group called Men United Against Sexual Assault on our campus, and I always make sure to put their information and their meeting times up so that students know ways that they can get involved. Other speakers have talked a little bit about social media. It is important to kind of be aware of what's going on out there and know how to use it. Judiciously, you can make use of various types of social media, I think, by sometimes there are things out there on YouTube or on other sites that are actually pretty good connections to what you're talking about, that it's pretty easy to download a link into like a PowerPoint presentation and just bring that up. A couple years ago, the Minnesota Coalition Against Sexual Assault made a really cute set of public service announcements for Awareness Month that kind of played on that idea of why are we always telling women how to protect themselves instead of going after the perpetrators, and I have showed those a lot in classes. Students really like them. On the topic of, one thing I guess that's different, so I'm on tip 4 now, I'm moving through kind of quickly. One thing that's different, I think, on campus from the rest of you is that instead of going in for a one-time thing or a one-unit thing, a lot of students on our campus are going to hear me more than once, depending on what their major is and which classes I get invited in to speak in. And so I do have a lot of different presentations that I try to cut and paste from or change up, depending on what level the students are at. What I do for a first-year class is going to be much more similar to what you're doing in high school than when I'm working with fourth-year women's studies majors, for example, who are moving on to graduate school. We can have a much different conversation in those classes about things like rape culture. And so I do change up the presentations based on who I'm presenting to. And then also, because you have a variety of majors and different kinds of classes you're being invited into, Kelly mentioned earlier public health as a focus for violence prevention, and we do have a lot of public health majors here at UW-La Crosse. And so if I'm going into a community health class, for example, we might talk a lot about what's the difference between risk reduction and primary prevention, and that kind of list that Rose put up earlier of supposed prevention tips. If it's a communications class, I might be talking about language and the ways that the media tend to report on sexual violence and things of that nature, so we might have a conversation about that. And then other people have mentioned this as well, but again, the kind of the self-care warning. At college, some professors may take attendance. There may be an attendance mandate in a class. At some universities, there's even a certain percentage of classes that if you miss that much, technically the professor can fail you. And so students may worry about not coming to class on that day. And what I try to do is talk to every professor who invites me to their class beforehand and say, can you somehow let the class know that this is going to be the topic today? And if anybody feels like they can't be there, they can privately message you, email you, and you could hopefully work out something else so they get the credit for that day. If they were going to assign a paper, for example, a reflection on what I came in and talked about, is there some other way that that student could get that credit and not have to just out themselves by leaving the class that day? So I think that's kind of it for my tips.
Great, thank you so much. Really appreciate all the presenters coming on and sharing some really great stuff that I know we can use in multiple presentations and classrooms. So just to end up for today, I've got some really quick announcements. If you stay with me for one more minute, on November 20th, we have a presentation that I'm really excited about that the Michigan Coalition to End Domestic and Sexual Violence or Abuse is coming to present on. And the reason I'm excited to have them is that they're a Midwestern state. They do rape prevention work, but they're being funded to do domestic violence prevention on those outer layers. And I think that as a prevention community, we're always thinking, what does it look like besides just being in schools or besides just presentation. So if you can join us for that. If you've missed things previously, you can see on the website on the bottom right of the screen that we have all of these videos archived, and including this one, we'll archive it later this week or maybe even later today, so please feel free to go ahead and check that out. Two other things that you might be interested in, might be useful, you can find on our website as well. There's a program called EPI Info. Some of you may be familiar, but it's kind of like a database analytical program. And it's something that we've been piloting with a few programs throughout the state, and it seems like it's a somewhat useful tool. And so we're offering a free training at the end of October. It's going to be like middle of the day, like 10 a.m. to 3 p.m.-ish, so that if folks do have to travel, they can do that in the morning without having to stay over. So if you are doing any data entry, if you're out doing prevention surveys and work in your community and you're looking for an option to put that in some kind of a database and really be able to use that information for grant reporting, to talk about the impact your program is having, I really, really recommend that you think about this. I know that database and evaluation is not the most exciting topic in the world, but if we can make it more user-friendly and meaningful, it becomes less of a burden. I think can be really some great opportunities for our prevention work to expand that and make it even better. And if you're any of our listeners, you probably are very familiar that we have a conference that we're co-holding with End Domestic Abuse Wisconsin and American Indians Against Abuse in November. You can check that out. And also a Survivor and Allies Task Force meeting in October that we're taking registrations for now. And that's in Wausau. So if you know of any people in your communities or folks that you've met during prevention work that might be at a good stage, to go to something, they'll be talking about education and healing, and there'll also be some movement and meditation and opportunities. So I encourage that. So if you can just send me one word in your chat that describes how you're feeling right now, we'll check out and call it a day. And I know I'll be the only one who can see it, so I'll read them off as they come in. So I hear someone saying excited. This was great and thanks for your work. Great ideas. Thanks for the tips. Smart. All right, and maybe a few more coming in. So that being said, lots of good information. I see that as well. I'm so grateful. Gracias. Thank you. Merci, all of those words. There's a survey link on the top. If you can take a second to click that out, tell us what you liked about today. We're thinking about what our model to engage with prevention workers looks like for next year. So we'd love to have your feedback. Thanks again. I'll send up a follow information email with the links and the websites and the PowerPoints and all that good stuff. And I hope that you all just have a fantastic rest of your week. Bye.